Hi guys, and first of all, before we start the live today with Aditi, with Dr. Aditi, I would want to thank each one of you for an amazing response to our PCOD series. We have been doing the series to talk about all the issues related to PCOD. We started off talking about my journey of PCOD. We spoke about the various yoga poses that you can start doing at home for helping you with PCOD. And today, Dr. Aditi is joining us, who is a very well-known face in the Bollywood industry, but now she has taken up mental health issue as a very important issue, and she's been helping people to understand how to deal with issues related to mental health. So she would be talking to us about all the issues related to mental health and PCOD, because when I meet my patients, I do understand that how much of hormones play issues with your mental health. You might feel mood swings, you might feel depression, you might feel certain confusion in your mind when it comes to your body image, because your body is undergoing so many changes. Your body is sometimes gaining weight, sometimes quickly losing weight, and that's when you can even get stretch marks, losing hair, or excessive facial hair or body hair. All these are certain issues that I'm going to be tackling and talking to you about, and super excited. And Aditi would be joining us in just few minutes. Till that time, we can take few questions from all of you. I've received so many questions, and most of those questions have also been about dealing with PCOD and how to diagnose it. I'm just also going to tag the discussion topic today, that's mental health. Yeah, that's a peacock, and the peacock likes to sit with us for the live. And I would be switching off the comment section, so you guys can please send me your questions in the question mark part. There's a question about weight is stuck, and I've been working out and eating healthy since last 4 months and there's no change. So it's very important, Janvi, if your weight is stuck, that you can talk about giving your body some kind of a shock. Change your diet pattern, maybe change your workout pattern, and are your hormones okay, because I don't have any history from you. All these things do help in a long way. So make sure you are doing all of this and taking a medication. And I'm really thankful to all of you for sharing your lovely stories. Yeah, I'm just waiting for Aditi to join us. Sorry, I've been working. How to control PCOD acne. So Archita, of course, when people have PCOD, there's hair loss, there's acne, which also becomes like a very, very bad issue. And acne can be dealt with hormonal medications, because it's generally hormonal acne which comes with PCOD. So if you have acne and PCOD together, first of all, we need to diagnose how bad is the PCOD, then go back to treating your PCOD, and there hence we come to treating acne. Because when you are getting treated with PCOD, your acne starts to get treated on its own. There are certain medications that the doctors can give you, which can be antibiotics or isotoin or spot corrector creams which have benzoyl peroxide or adapalene. They can really help. Meanwhile, also cut down on all your sugar and dairy intake, because that will really help you. treatments like photofacials, which are IPL based lasers, or black peels, they also really help in reducing the acne. So first of all, diagnosis of PCOD. Second of all, start using some spot correctors. Third, check your diet. Start reducing all the inflammatory foods from your diet, processed food, reduce the sugar, reduce the dairy, because they all will have an impact. And within few weeks and 10 days or something, you will start seeing a lot of good result. And I can see Dr. Aditi is joining us now. So I'm turning off the comments for everyone, because then that also creates a disturbance while our chat is going on. And while the comments are off, hi Aditi.
Hi, how are you?
All good, welcome. We are all waiting for you.
Thank you so much, Dr. Geetika.
So Dr. Aditi, I'm turning off the comments here, because then we will take up the questions towards end of the chat.
Sure.
And we can have our chat going on and discussing the PCOD meanwhile.
Yeah.
You're looking lovely, I must say.
Thank you. As are you. You're looking lovely as well.
Thank
you.
you.
I see a peacock at the back?
Yeah, the peacock is
wow.
actually, I think, here not ready to go fly today. He wants to say hi to you too.
Oh wow, that's so cool. That's magical.
Otherwise, they're very shy. They just, see
Yeah.
someone and they just fly away. But today, he nicely
that's
wants to
amazing
participate.
to have a peacock witnessing our talk today.
Absolutely, absolutely. So because everything is about happiness, about mental health, and beauty, natural beauty creates a lot of happiness. So why not?
Absolutely. Absolutely.
So tell us something about you. We have always known you as a very, very, shining, beautiful Bollywood personality. But tell us, how did you take this path of educating people about mental health? We would love to know about that.
Sure. So, Dr. Geetika, what happened was around 5 years back, since I am a medical doctor, I have always felt the need to study. I've always been that person who likes studying, and my kids even say that, Mama, why don't you give our exams, since you like giving exams so much? So 5 years back, I felt the need to go back to studying, because I just felt that intellectually I wasn't getting as much stimulation as my brain was craving for. So that was a junction where I stood and I asked myself, what should I be doing? Should I do skin? Should I do nutrition? Or should I study human mind? Because that would pretty much allow me to, combine who I was in Bollywood and as a celebrity and the medical education that I had. So I have already studied human body. So human mind was something that really intrigued me. I always wondered why we think the way we think, why people behave the way they behave. And at times there are people who, and including myself, at times you do something which is completely out of character and you're like, but that's not really me. Why did I do that? Or how come so and so person said something like that, which is so completely out of who that person is? And these kind of things, amongst the other illnesses which one saw, which was, I witnessed a couple of suicides in my industry these were girls that I was friendly with. I had done many shows with. One of the girls was supposed to get married in 8 days, and we were talking about Truzo. So her last show was with me, where we were sharing makeup room, and suddenly I hear this news. So that baffled me, and that's the reason I decided that, okay, psychology is something that I need to study, and that's what took me on this journey. So I finished my master's in psychology. I finished my post-graduation in counseling, and currently I'm doing my second master's from Harvard University.
Oh, lovely. That's lovely, Aditi. And today why we are here, as I spoke to you, was like a lot of my viewers have been talking to me about PCOD. Like even in my clinic, I deal with patients who come to me for treating acne or hair fall, but eventually when I investigate, I find out that they are dealing with PCOD. And because I'm a PCOD survivor myself, let's say, I have also been through that time, when you're in your teenage life, you want to look good, you want to look your best, you want to go out, meet friends, joining college, but your body doesn't allow you to be the best version of yourself. Your hormones are all haywire. You are gaining weight, losing hair, getting hair where you don't want. So that's a very, very difficult phase in life, because sometimes you feel your parents don't understand your peer group, you don't fit in them. So you're balancing so much mentally, and it's such a fragile age. So I would really want you to help the viewers today understand that, okay, this is going to happen, but it's temporary. You can survive, you can deal with it. But how to deal with these issues more logically, more strongly, that's what we want to learn from you today.
Right. So PCOD is a disease which one has to look at in a very holistic manner. Uh, I'm sure you give this advice to your patients, which is that yes, treatment has to be done. In addition, you also have to work out.
Yes,
Additionally, what I would say is do uh, not look at your mental well-being, because like you said, that anyway that age developmentally, even
exactly.
psychologically, is an age where you are trying to self-assess, your identity is getting formed, which is why a lot of us rebel against our parents, because it's not for any other reason, but it is just to have that self identity which we are trying to find, which is away from your parents. You're creating your own, you're coming into your own, so to say. And then there is additional peer pressure plus trying to fit in. So these kind of things does play up. And then if you have PCOD, it is in addition to
Yeah,
what you're already going through developmentally. So what one needs to look at is know, like you said, that it is temporary. It will
yeah,
go away. This too shall pass should be the mantra for everybody, for everything, is what I have come to. Um, it's one thing which I have learned. So even PCOD will go away. You just need to be at it. You have to be aware of the fact that yes, it comes with certain symptoms, certain
yeah,
signs. Be aware of it and take into account that what is it that you can do, what is it that you can include in your diet which will help you in handling this disease. What is it that you can take out? There are some
yeah.
things which are not, you're not supposed to have, so take those out completely from your diet. Exercising, like I say, that every single day, even if you exercise for half an hour, it will definitely boost many endorphins, in addition to taking care of your weight, because weight could be an issue with
Of course.
PCOD, as you're aware of. And that again can play a big role in your own image when you look in the mirror. So you need to take care of these things and meditate. Meditating makes a very big and impact on your body. And the reason for that is because when you're going through any stressful situations, there are hormones which are released in your body, because your body thinks, okay, there is a stressful situation, fight or flight mechanism, which is an inbuilt system in us to protect ourselves. Today's day and age, you don't really need to employ fight or flight mechanism. However, our brain, because it has evolved over millions of years, it is an inbuilt mechanism. So very consciously, you have to say that, okay, there is no stress here. I'm not at risk of survival. I need to calm myself down. So when you're going through this stressful period, oh, I'm not looking good today, or I'm feeling bloated today, or this jeans that I'm wearing is not looking good, that evokes an immediate response. So
Response.
that
Yeah,
leads to, and which we are not even aware of, we put ourselves through this. But what happens because of that is that you're constantly in that stressful mode, you're
yeah,
constantly in this fight or flight mode, which then again sets a vicious circle to incurring a lot more problems on
yeah,
ourselves.
yeah,
So the minute you realize, okay, I'm getting stressed out, you just focus on your breathing. The
yeah.
minute you start focusing on your breath, you will realize that you will automatically calm down. So the best way
Resetting
of, like,
everything with the breath. Amazing.
absolutely,
Yeah,
absolutely. And I pretty much teach mindfulness or meditation, which is connected to the breath, for this simple reason, that breathing is
beautiful.
something that is there with us throughout our life, right?
Yeah,
From the minute you're born till the time you die, breath is something that is there with you. And prana, as it's called, is so deeply affected by every single thought. So if you start paying attention, Dr. Geetika, that the
yeah,
minute you get a thought which is disturbing, you will see that your breathing will change.
absolutely.
That also means then your physiology changes. Immediately your physiology changes. Again, the hormones start releasing. Again, those, flight or fight might be triggered. So the
Yeah,
trick over here is to trick your body into telling the body that, and your mind, that everything is fine, everything is under control. Do not release these hormones which
you're
are so
absolutely right.
damaging to my body and my mind.
You're absolutely right, because your body doesn't understand that this is temporary. Sometimes you have to auto suggest, you have to tell your body by tricking by these small exercises like breathing. So,
Yeah.
be it in the morning or your beauty sleep. Otherwise, your body just understands that, oh, there is a stressful situation, let me fight or let me flight. And then a
Yeah.
stress hormone is released. And stress is a major cause of inflammation in the body, which is a major
Absolutely.
reason of PCOD. Inflammation is a major cause of aging, acne, hair loss, everything. So
So many
keeping your
things.
body as pure as a temple is really important. And
Yeah.
breathing is a very, very easy to do thing, which is with you everywhere, be it in the car, be it in the kitchen, be it in your
Yeah.
bedroom, be it sitting with
Yeah.
kids, be it watching
Yeah.
TV. You can remind yourself. So,
Yeah.
Dr. Aditi, can you share a good breathing technique for young adults over here who can do this at home?
Yeah. Now, what happens is, and I have to confess, it's happened with me also, that when I was younger, I used to say, oh, meditation and all that is not for me. When I grow
Yeah,
older, I'll do it. However,
yeah.
I do wish
The
now that I had,
meditation, yes.
yeah, that word comes with, okay, it's not for me. But what we have to realize is, what is meditation really? When you think about it, meditation is not something that you need to sit in one quiet corner and close your eyes and sit in lotus pose. And no, and meditation actually is way of life.
Yeah.
As I'm speaking to you, I can be in a meditative form. So what do I mean by that is that if I'm speaking to you, I'm very aware of my own breath as we speak. I'm very aware of you, your surroundings. Like I noticed the peacock, right? I'm
Mhm.
very aware of the surroundings that are around me right now. However, it does not mean that I'm not um, aware of what you are saying. So it's not like I'm distracted. There is a very huge difference between being aware of everything and everybody and everything, and then I'm not paying attention to you. No, not at all. I'm 100% in the moment, where I'm
Yes,
aware of how you're nodding, what your reactions are, what your micro expressions are, which also means that my connect with you will be a lot stronger. Now, think about it
absolutely.
when you're younger, right? For all the young viewers there, how how amazing would it be for you to be 100 present in the moment and give that attention to the person who's with you?
Absolutely. Power of
that
now, as we
that
say.
makes a huge difference. So
Yeah.
meditation is not something, I'm repeating myself again to say that, okay, it is not something that you need to sit in one corner and sit quietly for 1 hour. It is a way of life. Now, since we've lived whatever, however old you are, that many years without being in a meditative way of being, you need to train yourself. So first we have to unlearn a few things and then teach yourself to be in a certain way. That is why people say that, okay, sit for 5 minutes, practice meditation for 10 minutes, 5 minutes, whenever you get a chance, you do it, so that then it becomes a routine. That's
Yeah.
the difference.
Okay. And the easy meditation technique, can we learn something
Sure.
today?
So we can do it right away if you want.
Yes,
So it
absolutely.
is. So a little bit of background as to where I'm coming from, where meditation is concerned. I have done various forms of meditation, and I do not say that what I am saying is the right way of meditating. This is the way I found was easy for me, and whoever I have taught it to has found easy. However, if you feel that so and so meditation works for you, or that is what you've been practicing, please go ahead and practice
Absolutely.
any form of meditation is fine. It's not like, oh, this is mine so it has to be. I don't come from that school of thought at all. Where I come from, like I have done art of living, I've done transcendental meditation, and 12 years back I started vipassana meditation. So that worked for
Wonderful.
me. So
Yeah.
whichever form works for you, stick to that. Go and try how many ever you want. There's candle meditation, there's mantra chanting, there is, I mean, so many, right?
Whatever does it
Um,
for you. Yeah.
so yeah, whichever works for you, it's good enough. I come from Vipassana meditation background. So last 12 years, I've been practicing Vipassana meditation, and this practice, which I'm going to now share with you, is the beginning of Vipassana, which we are allowed to teach. Vipassana meditation
Okay.
technique, I'm not allowed to teach, so I don't. But
Okay.
Anapana meditation is what you can do it, which I can
Lovely.
teach you and you can do it. So, Dr. Geetika, I'm going to put you through this process. And for
Yes,
whoever
I
is
would love it.
with us, please sit comfortably. If you're sitting on a chair, do not rest against the back. So sit
Okay.
upright so that your spine is erect, not resting against the back, but straight up, but comfortable. So
Okay.
don't strain your back so that it's not over flexed or. Place your feet firmly on the ground. and your palms facing upwards. So the palms are like this on your knees, very gently. Chin is parallel to the ground. So it's not low or it's not high. It's just parallel. Okay. Now I'll just guide you through it. I will not close my eyes, but I will, so that I can see what is happening. So just close your eyes and take 2 deep breaths to fill up your stomach fully in and exhale fully. Now start taking normal breaths. Just your regular normal breathing. You're not forcing it. You're not taking shallow breaths. The way the air is going in and going out, just start focusing on that. Focus at the rims of your nostril where the air touches the nose and exhales. Start paying attention to that area. Now bring your attention gently to the area above your upper lip and below your nose. Draw an imaginary triangle in that area and focus on the air that's going in and going out in that triangle. An imaginary triangle from your nostrils to your upper lip. Okay, now rub your palms with each other. Create heat. Gently place them on your eyes. Open your eyes inside the palm and place your palms down and open your eyes. So that's all. We did it for what, like 10 seconds, 20 seconds. So what happens here, if you've realized, is once you start focusing on the breath, your mind will run away. Because our mind is like a monkey. It jumps from one branch to the other. And the job that you're supposed to do, which is paying attention on this part of your nose, it's lost. And it happens. It happens with the best of the meditators, where you've taken off somewhere and suddenly 2 hours are up and you've forgotten that you have to concentrate on your breath. And you're like, oh my God, what happened here? I mean, I was just supposed to pay attention to my breathing, and my mind took me somewhere else. And that is natural. So there's no need to feel guilty or feel like, oh my God, I'm so stupid. I can't focus even for 5 minutes. It happens with everybody. Even if you can focus on 10 breaths in the beginning, that's a very big achievement. Because the tendency of the mind is not to allow you to concentrate. So with this, what happens is it's your normal natural breath. And like I said, that living in the moment is the way to live. And the mind is not used to. You're either thinking about what happened yesterday, or what am I going to do tomorrow, or what is there for dinner, for example, after this, right? So this plays a very important role so gently bringing your mind back. The minute it goes away and you get aware of the fact that it's run away, you just gently bring it back and say, okay, let's focus on this breathing. That's all.
The idea is not to control your mind, because more we want to control it, more it will, play with us.
No, you do not. It's like a wild horse. You have to gently tame it. And then what happens is the mind realizes that, okay, I don't have the control over this person. Let me listen to her.
Yeah. I read it somewhere, in fact, a very nice saying to that your mind is your best friend, but as long as it listens to you, but it is your worst enemy if you start just listening to your mind. So you have to get into the driving seat and, tell your mind what has to be done and how it has to be done. So, Dr. Aditi, beautiful.
There is no other weapon, there is no other slave, there is no other anything that is as powerful as someone's mind. I mean, mind can really be so powerful, it can surprise us, but we have to know how to use it.
Lovely. Yeah, it's power of auto suggestion. It's power of
Yeah,
your own healing that you have inside. And
absolutely.
Dr. Aditi, these days, like my patients whom I'm educating, they're also having, a tendency to shift their routines because they have been following a certain diet pattern, they are following a certain lifestyle. And after educating them and after taking the treatments, they're understanding that they have to shift their choices. So
Hmm.
be it having glasses full of milk or glasses full of juice or
Hmm.
loads of processed food. So I'm teaching them a lot about mindfulness as well. Would
Hmm.
you be able to share some pointers on that? That what is this mindfulness, which is nothing like a very big word, but it is just using how and when. So you can maybe guide us on that.
Yeah, there is a lot of confusion where mindfulness and meditation is concerned, right? Um,
Yeah.
so, mindfulness is nothing but it is a kind of meditation. So, meditation is an overarching umbrella in which mindfulness is a part of it.
Mhm.
Mindfulness pretty much is being aware in the moment, right? In that sense, it is a meditative form only, but being mindful of even what you're thinking, if you go down to that level, that okay, because most of us 90% of the thoughts are negative, and research has found that the next day you think of 80% of the same thoughts. So imagine how much negative thoughts we have in our mind, right? So if you start becoming aware even of your thoughts, that's being mindful. I'm mindful of what I'm saying, I'm
Yeah.
mindful of my actions, I'm mindful of what I'm putting in my body. Like right now, currently in my Harvard masters, I'm doing psychology of eating, which is pretty
Lovely.
much, it's very interesting from
Exactly.
what
Exactly.
you've said that. Uh, Today, what has happened is we sit in front of the TV or we have our phone in our hand and we don't even know what we are eating.
Yeah.
Research again has found that when you sit in front of the screen, you'll end up eating more. So, for anybody who wants to lose weight or wants to become fitter, actually savoring what you're eating, relishing every bite that goes in your mouth, that will make a huge impact on how well the food gets utilized in your body. Because ultimately,
Yeah.
Dr. Geetika, you are what you eat and you are what you think. These are the only two
Absolutely.
things that make you who
Absolutely.
you are. So if this is the body that you have been gifted, in which your soul stays, why not look after it? Why are we
Absolutely.
destroying it? If we want to look after, if we want to be healthy, everybody wants to look fit, everybody wants to look good, but you have to then look at your actions, be
Yes.
mindful of that. um,
And to my viewers, it's your right to look the best, and it is all in your control. You just have to take charge. There is no knight in shining armor which would appear and help you,
Nobody else
take
does
care
it
of
for
it.
you.
It's you who has to take charge, and one day
Yeah,
at a time, as Dr. Aditi has said, and savoring your food, engaging in all the senses, smelling your
yeah,
food, tasting it. Your digestion starts in your mouth with
in your
saliva.
mouth.
So, taking those bites and then
Yeah,
savoring each and every bite. A, you will eat less. B, you will feel more fuller and happier after a meal like
yeah,
that.
yeah, yeah, absolutely.
Yeah.
Absolutely. No, it's a joyous process, but today we've forgotten. We just eat so that we can live. We are not really enjoying the process. And like you said, every bite, if you bite properly, it does mix
Yes.
properly with the saliva, which has amylase, which then starts the process of digestion. So
Yeah.
you're also helping your body to digest the food much better, so that you get maximum benefit from whatever you're eating. So that
And
is a very
and for the
crucial part.
mothers also here who are watching this live, I see so many children having child obesity and young girls having PCOD. So this is where maybe you can start teaching your child also to sit and eat at a dinner table with their family,
Yeah,
enjoy their food, and not giving into the binge eating because these days people are just watching Netflix and binge eating with their fast food. That
yeah.
is not going to help at all.
Absolutely not. Absolutely not. So that becomes a very crucial point to keep in mind, that, enjoy your food. I mean, enjoy
Yeah,
every bite. That is a very,
lovely.
very important thing in life. Yes.
So let's open the questions now, Doctor. I
Sure,
feel this
sure,
is a good
sure.
time. I have
Yeah.
received so many questions. Uh, there are questions for a lot of
There is one
praises for
pinned one. Ma'am,
you.
my weight is stuck. I have been working out and eating. Is that Janvi? Is
We
that
we have
because
the
I don't see my face? It's half covered with this
okay.
question.
So this one here, insecurity is there and economic loss in people, how to overcome.
All right. So this is my doctor,
Dr. Thakkar.
Jayesh.
Yeah.
Hi, Dr. Jayesh. So yes, you are right. Given the situation of lockdown, and I have been counseling a lot of people. I've been doing a lot of counseling sessions for a lot of corporate people where uncertainty has become a very big thing. Now, what I generally start my session with is that, can anybody on this chat, or for that matter, anybody in the world, guarantee that I'm going to wake up tomorrow morning? Right? Nobody can. So
Absolutely.
what does that mean? If I step out today from my house, or even if I'm sitting over here right now, if the ceiling falls on me, who's to say what happens next minute, right? Things change minute to minute. So what is certain is that uncertainty is certain, isn't it? Life is not certain at all. Nobody can say that, okay, for sure I will earn so much next year, or for sure this will happen. Nobody can. Which also means that this sudden uncertainty that's thrown our way, which is out of our normal uncertainties, is what has called this emotional volcano, so to say. That's because we are not used to it. We are not habituated. It's something new. However, know that life is uncertain. Everything is uncertain. So let's take this into stride. And what I have also observed is that there are people who've thrived in this, right? I mean, sure, people have lost jobs, people have taken pay cuts. Even those people who have gone through those kind of things have thrived. So it is up to you, like we had referred to earlier, that it is in your hand. Nobody is going to come and help you out of this situation. It is up to you how you treat this time. If you put yourself in a thrive mode, if you wake up tomorrow and say that my intention for the day is that today I'm going to thrive, and then remind yourself every now and then that, okay, I'm in thrive mode today. What does thrive mode mean? As opposed to survival mode. Arey yaar, this is a difficult time, pata nahi kya hone wala hai. If you get into that kind of a conversation, that conversation is very different from if I say that I'm in a thrive mode, what can I do today? Automatically your mind starts thinking of ways which will get you in that thriving mode. How can you upskill yourself? How can you reach out to people who you've lost touch with, but who can be in your life and can bring benefit to your life? Who are those productive people? Who are those creative people? Bring those back into your life. Then all this conversation that you're having, oh, I'm in a lockdown, oh, I'm locked in my house, I don't know what's going to happen, goes out of the window, because then you go into a thrive mode.
Absolutely, rightfully said, doctor. Another very lovely question, which I myself practice, is gratitude practice and gratitude meditation. If you can please shed some light on the same.
Sure. So gratitude and love, these two emotions, or these two states of being, I would even go to say, are the highest that a human being can be in. So let me start with love. When we say, okay, what is love? That if I meditate on love, I can say that, first basic, this thing is, I want so and so to love me. I want my spouse to love me. I want my parents to love me. I want my children to love me. Then you meditate, go to the next level to say that, okay, it is me. I will love my children. I will love so I will love, or I love so and so, right? Or I love green color. I love whatever. If you meditate further, you will realize, now this is very, very different and very deep in that sense, to think, what if I start saying, or what if I use the affirmation saying that I am love? You get the difference from I will love or I love somebody. I am love. If I am love, imagine how everything changes after that. Right? So that is the love part. Gratitude. Now, what is gratitude? Like everybody now, there is one thing which I would definitely like to bring up over here, and there's a reason for that, which is I do Dr. A talks, right? Dr. Geetika, you know that.
I saw,
And a lot of people say to me that, I'm very grateful because at least I have this. So what if I don't have this? The thing is that for you, that is your truth, and you got to accept it. If you are in pain, you are in pain. Your pain is no lesser than the other person. Just because For example, let's say that, okay, I'm grateful that I have a roof on my head, but I'm sharing it with 10 people, but I have to be grateful that I have a roof. But if I'm not getting my space, then it's painful for me. So I got to relish that. I got to actually feel that pain. Otherwise, you're suppressing that negative emotion, which is then going to manifest into much bigger issue. So whatever your pain is, it is your pain. It's fine. You need not feel, oh, I need to feel grateful because I have this. I don't have this, so let me suppress it. No, you have to go beyond that to acknowledge the fact that this is what is happening in my life, which is not pleasant, which is a setback, which is a negative thing. It's okay. I need to look at it that, okay, what can I do to get over that? So you take steps to take action. Don't sit and complain, because we all have this very bad habit of complaining mentality, right? This is not,
Easier.
this is not, but then do something about it. If you don't
Simple
have it,
as that, even with like PCOD, the way we were talking, accepting you have PCOD is also the key. Many times I would tell my patients, please go and get yourself tested. They won't go for the testing because they don't want to accept it. And they would say, oh no, my lifestyle is such, I just have to eat junk. Unless you don't take the ownership of your own self, no one can help. So take ownership, accept the thoughts, and do manifestations, like Dr. Aditi has said.
Or then don't complain. Don't complain, live with it. Then don't grumble that, okay, my weight is not going. If you're going to put in whatever you're putting in your body, it's going to stay.
Yeah, acceptance is your first block, and then do manifestations saying, I am healing. And the moment you say these positive things like, I'm loved, I'm healing, I'm beautiful, my tests are coming okay, these things will also help you being positive, and it will help you heal from inside.
Yeah. So you got to attack the disease from all sides, right? I mean, it is a dis-ease.
Absolutely.
You want to be at ease, you got to attack it. You have to be a little more aggressive in who you are and what you're doing, and take care of it. So whether it is exercising, whether it's following the whatever you are advising, whether it is meditating, you got to take care of it. Or then just say that, okay, I'm not going to do that. Let me be. That's fine too. That's your choice.
Interesting question from one of my very important followers. She follows me in all my life, so I know her already through Instagram. And she has a problem which I think a lot of Indian women face in COVID situation, especially because you are in your house. So any tips for her?
Okay, so what happens is that in India especially, what I have seen is that once a lady gets married, a girl gets married, you're not only married to the husband, you're married to the entire family. So you got to face that. You have to first accept that this is how it is and this is how it's going to be. Now, if your mother-in-law is a bully, if you think about it, if you think about the psychology of a bully, it's pretty much a person who's gone through a lot of bullying herself, which then manifests as something, in their next stage. So look at her life. What has her life been? Was she bullied as a Bahurani by her mother-in-law, or perhaps by somebody else? So get to the root of the cause. See where is the bullying coming from and why is she saying or doing what she's doing. If you think a little deeply and then look at this person with that lens, things will change automatically. Then if you become grateful to whatever her contribution in your life is, if you meditate on that, again, the lens changes. And once you start doing it, and I'm not saying, now there's a very big difference in being able to handle a bully, but not becoming a doormat. I am not saying become a doormat. However, you have to do whatever you're doing with respect, because at the end of the day, we as Indians, we respect our elders. So you have to keep that in mind. And look at her history, look at her life history. What has she gone through? Do you know where she's coming from? If you sit down and speak to her by keeping yourself calm, what happens is it's a trigger, right? The minute mother-in-law comes in your mind, your physiology changes, your breathing changes. So if you start observing if your physiology or your breathing is as calm as it is when you're not in her presence, automatically that person changes.
Yeah. So coming from a place of love.
If you don't give the reaction you've been giving, it will take her by surprise.
Yeah.
Because ultimately, why are they doing what they are doing? If I'm getting that emotion from you, which is satisfying me as a person, if whatever personality that person has, if I don't get that from you, if you are this calm Buddha, how much will I shout or scream or be nasty or be malicious or do whatever she's doing, right? She cannot. She will have to stop. She'll have to find new ways of
Yeah, just
perturbing,
coming from a calmer, happier place, focusing on the good part and not the
Yeah.
negative. Just to start with this, that can shift your entire relationship, I think, in a big
Yeah,
way.
but it also does not mean that you ignore, huh?
Yeah,
Because it's
of
not like
course.
you can ignore the negativity. You have to address it. If she's saying something nasty to her, ask her why. That
Absolutely.
whatever mummy ji or whatever you're calling her, that you said this, why are you saying this? Can I know? Can I get an
Absolutely.
explanation for this? What
And
is she
before
going to say
entering,
that?
yeah, and before entering in the conversation, give lots of love. As you said, say it to yourself many times during the day that you are loved, and it will
Yeah,
come to you.
yeah, absolutely.
So I think we'll take the last question of the chat today. I have so many
Sure.
questions, Doctor. It's amazing. And I feel like helping each and every one individually, but we have limited time. So we are
Yeah,
touching base upon some topics today.
yeah,
Sometimes I really feel my heart sinks. And is it due to anxiety? If yes, then how to control it? I think due to lockdown, that's a very important question because you're inside your house. Many people do face anxiety disorders and they don't even know they are living alone with their spouses. How to deal with someone who's feeling anxiousness or insomnia?
yeah. So anxiety, stress, and panic is on a huge rise in today's day and age, again because of the unnatural circumstances that we've had to face. Now, like I said to you, first of all, look at what is causing you anxiety. What is the reason for your anxiety? Because there is always some kind of a trigger which triggers the anxiety or the panic attack or that feeling of your heart sinking or the heaviness in your stomach or sweating or palpitations or whatever, low blood pressure. There are many physiological symptoms that
Yeah,
manifest. So think about or go deep into what is causing you anxiety. The
the
minute you
trigger.
identify it, there are two things to do. Either you take action, like I said earlier, that you take action. If there is something that you can do about it, go ahead and do it. Reach out to people who can get help for you, or can help you. Second, if you can't, because there are times when you can't change, it is not in your hands, certain things are not, then learn to accept it. Then say that, okay, this is the situation, what can I do? How can I then change myself? So change your outlook to it. Of course, it's not as easy as I'm making it sound, because there is a therapy which comes into picture, which I practice to reduce anxiety. So there are various techniques that we psychologists employ to decrease the anxiety. I'm just giving you a very brief and a very superficial kind of a response to the question, because otherwise it will go into hours, right? So,
Yeah.
and again, meditation plays a very big role even in anxiety.
Thank you, Doctor. And I feel
Thank you so much.
the great takeaways for all of you today is one day at a time. Accept your realities, don't ignore it. And meditative technique that Dr. Aditi has shared with us is of immense use. I'm going to be sharing this live with all of you. It's going to be on my page in the IG section. Please watch it and follow the meditation and do let me how it was. Thanks, Dr. Aditi, for joining
Thank you
us. And
so
I'm
much.
sure
Thank you,
I would
Geetika.
love to invite you again because there's so many questions and mental health is as important as any
It
other
is.
health, your body health, skin health, everything. So thank you
Everything.
for joining us and thank
Thank
you
you. It
for
was a
sharing all the
pleasure. And thank you,
information.
everybody, whoever's watching. Sorry, we could not take all the comments, but I do look forward to interacting with you very soon. Take care, Dr. Geetika. Thank you so much
Thank
for
you,
having me.
Doctor. Thank you for joining us.
Thank you.